Hi, everyone, and welcome to the third episode of the ANGIE podcast, where we discuss emerging issues on targeted drug delivery. I am Maria Vliora, your host for today. And so far in this podcast, we have discussed details of the ANGIE project, the impact of nanomedicine on targeted drug delivery, the use of nanoparticles as part of childhood cancer treatment, and how to raise awareness on targeted drug delivery. Today, we will see a different approach on the issues around targeted drug delivery. We will talk about the market opportunities for nanomedical startups and what entrepreneurs in the field should be aware of when marketing their ideas. To discuss all this, today is with us Vittorio Bava, a venture ecosystem builder from Verhaert, a pioneering innovation company for products, services, and businesses. Hi, Vittorio. Thank you for being with us today.
Hi, Maria. Glad to be here.
So before we start, would you like to tell us a few things about yourself and how you're involved in the ANGIE project?
Sure. Where do I start? So, long story short, I started at Verhaert more or less a year and a half ago as venture ecosystem builder, which means I deal a lot with startups, and especially with incubation acceleration programs and also tech transfer programs. And I do that because I have a background as an entrepreneur. I started my career at Google, but then I quit to start a company, which failed. Then I started another one that went so-so, but kind of failed afterwards. But then third time the charm, I started the company with a friend, and we managed to raise some venture capital and even sell it to a listed company later. So let's say I've seen the full arc from idea to exit to a listed company, and now I'm in a position to help future entrepreneurs or aspiring entrepreneurs to make their idea come true.
Okay, so what is your take on the new developments for localized drug delivery?
Well, that is surely a very, very promising field. When I have to explain it to my colleagues or the people I work with, I can't withhold the enthusiasm about it, because it's a bit like going from how can I say it, a really undiscriminated type of action to a super precise one. Let me be more specific. Right now, for a great variety of pathologies, especially cardiovascular accidents, even in the central nervous system, or tumors, which are, by the way, the first two death causes for most of the population. The actions are taken by doctors are very general, and that means that if they, for example, inject a drug, the drug goes all over the body. And in the case of chemotherapy, for example, that means that the little poison that is supposed to kill the cancer cells actually affects also all the other tissues. So there is a system level damage. And if you want, you can compare that to carpet bombing indiscriminately. What localized drug delivery is a super precision targeted missile strike, if you want to keep the comparison, because you can offload a higher quantity of the active principle in a very specific place. So let's say, for example, you have a 1,000, 10,000 times higher concentration, but only in a very specific spot, which means that you don't do damage to the whole body, but you only affect the interested area. This is a bit of a revolution because it changes the way people get cured. And in this, let's say, new way of doing things, there are enormous opportunities for aspiring entrepreneurs, people that want to launch their medtech company. and we're here to help them flourish.
So the ANGIE is dealing with magnetically steerable nanorobots. Is the wireless steerable nanorobots the way to go?
Well, I'm not claiming to be an expert in this. This is one way to go, but for sure that is very promising. Just allow me to, for the sake of the example, list a few of these methods. For example, there are the nanocapsules, and they are transported by the bloodstream, let's say passively. But in this case, the special thing is that these nanorobots are magnetic. So with magnets outside the body, it is possible to steer them and to position them in a very, very specific place of the body that often is impossible to reach in other ways, for example, surgically or otherwise. And once these nanorobots are in the interested area, they can dump the content that they're carrying, and in this way, the active principle is delivered locally. I believe this is very promising because it gives control, let's say, to the doctors to go to a very specific place that they have identified previously through diagnostic means. So of all the methods, let's say I am very positive about this, but I'm not claiming to be an expert, a technical expert. I have a background in business and entrepreneurship. But yes, I do see potential in that.
Okay, and if someone, an entrepreneur, wants to start related businesses, what are the opportunities for them out there?
Well, like in any other entrepreneurial activity, you always start from the problem. However, there has to be, of course, a match between the tools and resources that are available to the entrepreneur and the problem that they aim to solve. So what I had the chance to observe in medtech in general is that obviously people start from their field of interest. You know, if somebody has studied a lot a very specific pathology, they probably know a lot about it, and maybe that could be the area of focus. So this is a bit of a different approach from, let's say, some other industries where you find a problem and then you oftentimes people, let's say, learn along the way because the learning process is relatively accessible. In medicine, it's a lot steeper. So you either start from what you already know, or you go to a tangential field to what you already know. But the bottom line is you start from a problem that you identify, but that has to be a problem that the entrepreneur is somewhat familiar with already, because it would be very difficult and it would take a long time to venture in something of completely new. I hope I'm not being too generic, but it's inevitable because, you know, in medicine, that's how it is.
So where does an entrepreneur start from when they want to market their idea? Let's say that they have the idea. Where do they start from in order to put it out into the market?
So, first of all, they have to have at least a good probability that is something that works. That comes from experiments. So that is the what, and then is the who. Usually this is not one man or one person enterprise. It has to be, there has to be a team, possibly a team with complementary skills. In other fields, for example, in software, but also in technology in general, usually there is a 3H magic team. There is a hacker, a hipster, and a hustler. a hacker is the technical person, a hipster is the designer, and the hustler is the business person. Now, this could be translated also in medical endeavors, where the hacker inevitably has to be a doctor or, let's say, a bioengineer, someone who is very technical. Designer, in this case, could be more a product manager or somebody that, let's say, connects the market, and market in this case is not just the patients, but actually the institutions, the hospitals or the pharmaceutical companies that could be the actual buyers of the solution with the technical development team. And the hustler is the centerpiece, often ends up being the CEO of the company, is the person that, let's say, pushes everyone forward. So it's about the organization, it's about, getting things done, sort of visionary, but also executive types. In my experience, that is kind of rare to find in doctors or people who were involved in healthcare, because they are understandably very focused on the patient, on health per se, and sometimes might be strangers to the world of accounting, for example, or labor laws or this sort of things. So my advice is, if you come from a technical field, try to find a business partner, somebody who has had a minimal experience in running an activity, because even if the product is different and has a lot of peculiarities, what is necessary here is not just a stock of knowledge, but a mindset. And the word of caution that I have is that healthcare professionals may or may not have that mindset. And if they don't have it, it's a good idea to find a co-founder. In order to find, I hope I'm not drifting too much, but in order to find a co-founder, it's not just something that you look at the CV and hope it works. It's necessary to have some sort of co-founder dating before. You have to understand if you get along with the person, because in the best case scenario, you're going to be working elbow to elbow for several years, sometimes even more than a decade. So it's a bit like a marriage, or let's say a very solid partnership that has to be formed. So you might want to have this sort of exposure before signing papers.
Okay.
Does that make sense?
Yes, it makes sense. Can I ask you something here?
Sure.
If one of the three ages is missing, because as you said, you do not always find the right partners to, at least it is very difficult to find the right partners to start the company. If one of them is missing, either the hustler or the hipster, or
those are jargon words, by the way. I was jokingly using them, I hope.
Yes, but is it like a recipe to fail, or can someone take up two roles at the same time?
It can, of course. It's not unusual to even have a single founder. But I mean, even if that happens, it's rare, and it's rare for a reason, because it's difficult to wear many hats and be good at all these tasks at the same time. I've seen a lot of people grow into the role because of the need. So that is a possibility. But the fact that they have the time to grow into the role is very dependent on the competition that they have and the resources that they have available. Because if you, what happens frequently is that people or founders run out of money before they figure things out. So the quote about this, which can be used not only in business, but also in many other endeavors of life, is that If you want to go fast, you go alone, but if you want to go far, you go together. It's possible that you go far alone, but it's a path full of risks. So nobody forces you to partner up with somebody, but it's a good idea to have a team rather than a single founder if you got the chance to partner up with somebody. The discriminant in this case should not be skills per se. Of course, that's important, but the biggest thing here, I believe, is motivation. Because starting your own business is a very all-encompassing experience. So if somebody is motivated and ready to endure the ups and downs and emotional roller coaster that having your own business implies, then if there is a knowledge lack, they're going to figure it out. Why am I saying that? Because a lot of people dream about having their own company, but not everybody is familiar ex ante with the vastity of effort that it entails, but also the anxiety of not knowing if the company is going to make it or not. I often use a metaphor. One thing is reading about a boxing match, with Mike Tyson throwing punches, and one thing is getting punched in the face by Mike Tyson. So sometimes there is that revealing experience when somebody starts a business. I hope I'm not scaring the audience, but what I'm saying is the preparation for oneself, but also the sort of checks that have to be done with potential co-founders or potential partners have a lot to do with motivation and character, and a little less to do with skills.
Nice. So on the way, are there any other elements that someone should pay attention to?
Well, yes. It's natural if somebody pursues something that they are familiar with, but the obvious check that has to be done is whether there is a market for something, whether the market is big enough, and that in the case of medical technologies is not just the number of patients, but also the availability of substitutes, or let's say the economics that revolve around a specific pathology. The world is very complex about these things, so a few generic words of advice cannot substitute the analysis that an entrepreneur has to make, but the opportunity has to be there. It has to be visible neatedly, it has to be a clear picture rather than a generic intuition, or even worse than a hope. Because before throwing yourself in something that is going to be so intense, you want to at least make sure that you saw it correctly. Yeah.
So when someone has an idea that it's, let's say that they have done their analysis of the market and the needs out there, they do not usually have the money to fund their own ideas. Do you think that there are enough, or at least are there any funding opportunities for people that want to start a business in targeted drug delivery?
Right. That was another thing I was going to mention. I stopped myself because I thought it was going too long. So, of course, the challenge that they have in front has to somewhat match the resources that are available. By available, I mean also potentially available. Stupid example, I've seen a lot of pitches of people willing to build their own spacefaring civilization that will cost several trillion euros or dollars. So, I mean, it's good to be ambitious, but sometimes, one has to be realistic. So let's say that an aspiring entrepreneur has found an idea or an opportunity to pursue, and the opportunity is somewhat reachable, but say that they need few millions to get off the ground or a few €100,000, and then maybe they could need some funding later on. There are plenty of opportunities, and I'd like to take a moment right now to maybe make a little dissection of the opportunities available. So there are two types of funding that are the distinct because of the effect that they have on let's say the composition of the shareholders of the company. So non-dilutive and dilutive funding. Non-dilutive means when you don't have to give away shares of your company or stake of your company, and those are typically grants. That could be research grants or entrepreneurship grants, for example. But let's say that a lot of these things are available for entrepreneurs that aim to do something in the medical field. It's a matter of looking them up. Some things that perhaps are overlooked is also there could be technology transfer grants. So the government is often investing in big science projects, and if you find another usage for those technologies developed with taxpayers' money, oftentimes the state wants to favor that and issue some grants for that. There are some private foundations that also give away grants, often, but not always. They're targeted to a specific disease, typically, or the disease that killed the person that left the inheritance for that foundation. Sometimes there are also corporate grants. So some companies are active into some fields, and they want to, let's say, foster the startup community, but also, let's say, have an eye on what's going on. And if there is something innovative, they might snap it up later down the road. But that is for sure something that at the early stages of a company could be something to look into. Then there are also some incubators or accelerator programs for startups in general, but sometimes they're also very specific for medtech, that they offer services very often, but also sometimes some non-dilutive grants. And that could be a very accessible way of getting initial funding. And last but not least, clinical trial grants is a possibility in the medical field that is something to look into, because there is money available if you have a solution for a problem. So that is the bottom line. Now, these are the things that many entrepreneurs find preferable, let's say the top priority in terms of funding, but not necessarily. One other category that I mentioned was the dilutive funding, which means when you give away shares. This is important because shares are forever. Once you sell some shares, it's very, very hard to buy them back. And so same considerations as for the founders dating. You want to be sure that you're partnering up with the right investors, because you're going to have them forever. There are many ways to get this sort of funding. One classic way is an investor comes along and buys some shares in the company. Could be a venture capital fund that specializes into that industry, for example. It could be even some angel investors, or at the very early stages is the 3F, family, friends, and fools. If you can convince your closest people that you have a good idea and they trust you, they might, put their hand in their pocket and see what they can give you. A lot of let's say good relationships have been burned through this sort of funding, but also that was some other times the first step of a very successful venture, and or also very good friendships if you manage to make the people that you know and they trust you, you make them rich. This is also a good signal that for later investors, that if the people that know you the best trust you with their savings, probably you're trustworthy. So definitely something not to disregard, but you know who your friends are and family members. Another way, so instead of buying shares, another simpler way could be to issue a convertible note. The internet is full of templates for these things, usually 1 or 2 page document where the entrepreneur and the investor agree on a certain amount, so minimal paperwork. The advantage for the entrepreneur is that it's minimal paperwork, and if things go well, this debt, because that's what it is, converts into shares at a later stage, so it dilutes the entrepreneur less. But from the investor point of view, the advantage is that if the company goes bankrupt, debt is senior to equity in the bankruptcy process, so they get the money first, so they're protected. And also by not having the paperwork, they get in the most interesting companies very quickly, and if things go well, everybody's happy. If things don't go well, they cry with one eye only, as they say. So those are the 2 most common ways of doing business of having some dilutive funding. Rarely there could be something called mezzanine, which is a sort of convertible debt that goes in between, but this is typically for later stage companies, so maybe that's not as interesting for the audience of this podcast. I hope this list was meant to be sort of a panoramic view, just to have an idea of what can happen. Of course, possibilities are infinite, and if 2 counterparties are willing to negotiate whatever they want, they're free to get to the agreement that they want. But typically, things happen in this way.
Okay, so when someone is starting their business, is this something that they should do, or something they should not do? The things that they should avoid while they're starting their own business?
That's an interesting question. It's a pretty broad one, so I think I'll have to provide a relatively generic answer. So one thing I would advise aspiring entrepreneurs to do is to don't disregard legal details, and specifically don't go cheap on lawyers, because a good lawyer could save you a lot of money later down the road. So even if at the beginning with limited resources, it might seem that spending it on good lawyers could be taking it away from product development, having your papers right in terms of labor contracts, in terms of incorporation, in terms of all these things, saves you a lot of headaches down the road. Especially because problems are not very visible when companies are little or when things are going bad. But as soon as things are going well and they're picking up, then any sort of people that could cause troubles because they want something from you start to show up. So if you have your legal details done well, you're not going to have that problem. So that was a generic tip. Another generic tip that the audience might have already heard is hire slow, fire fast. It takes some time to find the right people and to be sure that they're the right people and that they want to join. So it's okay to take your time to increase the team, especially because, one new hire when you're a team of 2 or 3 or 4 is a sizable percentage of the team, right? So and that implies a shift in the company culture. So you want to be sure that you match in terms of culture, attitude, values, all these things. Conversely, if something is not working out, there's no incentive in pushing the can down the road. Some decisions are difficult, and for first-time entrepreneurs, it's super difficult. That sometimes they compare it to, losing your virginity. The first time you fire somebody, it's awful, sometimes comical, but the second time you have to do it comes easier. Sorry for the spurious comparison, but it is what it is, and this is something that first-time entrepreneur probably need to hear. Something is not working out, you just cut the cord. But this generic advice is not substitute for your judgment, so please take it with a pinch of salt. I could keep going, but I don't know if these things are too generic, maybe.
I think we are fine. I mean, we do have a nice view of a few things, at least, that someone should have in mind when they start, and how to manage their own, let's say, their own company at this stage.
Okay, then I have a few more, if I may.
Okay.
Sure. So one thing in my personal experience, but also something that was validated by other entrepreneurs, is it makes sense to write down your vision, your mission, your company culture. It's just an exercise for yourself, but you realize that when you write it down, you have to really condensate your thoughts and your ambition, where you want to go. And those things end up conditioning you, first of all, in the way you operate, but also they are a magnet for the right people to join you. Recently, in another industry, in the crypto space, you could see a lot of manifestos. This is something usually borrowed from politics. That's where you write a manifesto. But, companies in that field are somewhat revolutionary, or think to be revolutionary. So that's the way they pitch themselves. Even for medical companies, it is sensible to write down the vision, mission, and company culture, because will attract the right people, but also will guide you in the right direction every time there is a moment of direction and certitude. And maybe I stop here with the tips.
It's fine. I mean, they're all very useful for someone that is starting right now. Do you think there is any space for collaboration in the field of targeted drug delivery, and how does it work in this field?
For sure, I think collaboration, it's inevitable in this case, because it's a very complex ecosystem, and it's pretty much impossible that one single organization covers all of it. So an entrepreneur will have to collaborate with research centers, with universities, with hospitals themselves when they do their own research, and other facilities to conduct the testing. So that is not even a debatable thing, I guess. There are many ways to structure a possible collaboration. So I would advise to sort the details in advance in order to avoid misunderstandings, or actually also define the way to communicate with the partners in advance in order to avoid misunderstandings, because that's another thing that if not structured in advance, it becomes a hairy problem later on. So who owns the intellectual property, for example, who was responsible if things went bad, all these things. So this is something that is definitely a must to sort out in advance. Similarly, it's important to think through if there is any conflict of interest, right? If the interests of the two organizations are not aligned, how to deal with that, or if something that the company, the entrepreneur control at a certain point is something that they're going to lose control over later on. This is something to think in advance. On the other side, though, there are all the advantages of having a partnership. For example, is having access to resources, to labs, to people, to knowledge, sometimes even intellectual property itself. Many universities give away their patents or license their patents. But not only universities, could be also some other institutions. There are a lot of accessible resources that a young entrepreneur, or even not young, but like a new entrepreneur could access. Also, in terms of sharing costs, I mean, access to resources doesn't have to be free necessarily, but having a lab is surely cheaper. You're using it a few hours per week than building it your own, but also reducing risks. For example, if the partner institution has already some experience, it could spare you a lot of painful learning. And also sometimes the advantage could be also in terms of speed. If you need to reach a certain market and you partner with somebody operating in that market, that basically gives you instant access to the whole of it, instead of building your own network and training your own commercial people and all these things. So those are just some pretty universal advantages or disadvantages, or actually attention points. Once again, this is no substitute for the judgment, but every time you approach a partner, you should have this sort of exercise done in advance of what's in it for them, what's in it for you, and how you structure the deal.
Okay, so we have talked about how to start, how to find partnerships and funds to start your own idea, but what if someone is interested to start, but they do not have a very well-defined idea yet?
Well, there are some. First of all, it's already a good starting point if they have at least an intuition or something, rather than, I want to be a company owner, which is something I hear sometimes from teenagers, but from educated professionals, you would expect some more detail. If you have an idea, a generic idea, there is a refining process that you can go through. It's sort of bifurcation, a decisional tree full of bifurcation. So you keep discarding options that are not viable. So this is one way to go from a generic to a specific idea. Another thought process on how you get there is by partnering up with somebody, either a co-founder or an institution, because maybe what you end up doing is going to be a blend of your priorities and their priorities. And if the direction is something that suits well both of you, then you can push ahead. And another way to proceed about this could be to just start using, for the sake of your own mental exercise, to proceed with the tools that are generic tools that are available, like for example, business model canvas or Porter 5 Forces, SWOT analysis, all this, let's say, first year of management school type of exercises. There could be something new to medical professionals, but to anybody of the support stuff that I mentioned previously, could be something that they can provide or help you with, or in the age of information, you can even look things up for yourselves. But the idea is, by going through some of these existing tools, you could refine your idea either by understanding something that you didn't understand first, or discarding something that you thought you could do earlier. And so what you end up having in this evolutionary process is an idea that is more solid than the one you started with.
Okay, this is very interesting for someone that is thinking to get in this field. Are there any resources available for people who would like to learn more or get involved?
Well, okay, this is going to be a little bit self-serving, but we're all in this together. First thing you could do if you're interested in targeted drug delivery, and especially through magnetically steered nanorobots, would be to visit the ANGIE website, which I'm going to say out loud, or is going to be linked maybe in the...
I will have everything linked in the description.
Okay, but just for people who are listening, is h2020-angie.eu. So that is our website, where you can also find some information about the upcoming accelerator. We're going to treat a lot of these topics, to address a lot of these topics in the accelerator. But if not, there are, let's say, some existing resources. First of all, there is a bunch of drug delivery, pharma, biotechnology influencers that are pretty active on Twitter, LinkedIn, and other platforms. So if you're from the field, you're probably already following some of them, and they're often posting stuff that is relevant to this. I'm not going to pick and pluck single names, but you probably know who I'm referring to. Then regarding legal help, there are some law firms that are specialized into this. For antitrust reasons, I cannot name single names because it would be odd, but let's say if you want to incorporate, make sure that you pick a lawyer specialized into startups, and they will have a list of resources. There are also some drug delivery or medtech in general incubators or accelerators, besides the ANGIE ones. So they're accounted close to 50 of them, I believe. So oftentimes they're regional or national. So wherever you might be listening from, have a look at what they're doing in your country or in your region, because in those incubators, accelerators, there's probably a list of resources or even templates for documents sometimes. And lastly, venture capital funds or even corporate venture capital funds, they try to establish primacy in their own fields by sharing knowledge. So if you follow them on Twitter, LinkedIn, or even just have a look at their websites, you could find a lot of insightful articles and opinions about your industry. So that is another category of resources that I would pay attention to.
Okay, thank you. With this, I think we can conclude our discussion today. I would like to thank you for the very, very interesting take on the market opportunities and the roadmap for the entrepreneurs in the field of targeted drug delivery. And I would like to thank everyone for being with us today. Stay tuned for more episodes coming on the Angie podcast, and follow us on X, LinkedIn, and our website to keep up with our news. Everything will be linked down in the description. Thank you, and see you soon.
It was a pleasure to be here.
Thank you.
All the best.